So my question here was, who is the one who really heals? And as medical professionals, we diagnose and then we give therapy, medical, surgical, and allied therapies. But then after that, what do? We say, well, go take rest. We all wait for the wound to heal. We are waiting for the infection to subside, for the mental situation, whatever the situation. We give the therapy. It could be, but then the patient or the person who's going through the challenges, they have to heal their own body. And so who is the healer? And this is written by Dr. Raja Yanka. I got introduced to this book, Healer Within. The healer is within ourselves. It's not outside anywhere. But do we know that healer? Who is the healer? And that is what we're going to journey about. And so most profound medicine is produced within the human body for free. I want to start with the spiritual part. The word spire is in Latin, means breathe. That is from vocabulary.com. And what it says is that, so respire is breathe again. So when you say spirit is equal to breathing, and then respire is breathe again, because you cannot just breathe once and say, okay, I'm alive. But the breath is what infuses, as you can see here, it infuses and animates the life here. And it's very interesting that this thing, for example, here, it animates the life, Latin word. And now, what we learned on the right-hand side, you can see what we learned is the ABC of life. I'm going to come back to the doctors. Airway, breathing, circulation. Whenever somebody has a cardiac arrest or something, we would do this. Airway, breathing, circulation. That's how we jump-started the whole life. And that's where the airway comes the first component, very crucial. And then only I did all the circulation part, but I was dependent so much on this as a vascular surgeon. Spirit is life principle of vitality. In Vedantic philosophy, they call it Chaitanya or Prana. In Taoism, a Chinese philosopher is Qi, pronounced as Qi. Japanese say Ki, Harakiri, you probably heard about that one, Ki. And Greek is Pneuma. Mandic is Ruha. And Rock is Hebrew. Everything means life principle, vitality. And everything turns down to breath, actually, believe it or not. So now, how does the medicine come about? Now, we have three processes that happen in the body itself. The body has a very profound intelligence. I call it as a biological intelligence. Homeostasis was the word introduced before for all of us. What is homeostasis? Homeostasis means achieving an internal balance. This is very familiar to us whenever we have situations like, for example, have sugar, eat sugar, then pancreatic insulin comes out, things like that nature. For example, breathing part also. When you're anxious, your breathing becomes short. And when you have to run, etc., things adjust by itself. And if you are having high temperature, you start sweating. These are all the homeostatic mechanism. The body has an intelligence to figure it out as to what to do. Even the whole response of running away from problems and running becomes secure. That is also a part of homeostasis. And that involves, of course, the steroids and adrenaline and all that. We know about that in the stress mechanism. So what is allostasis? Allostasis is ability to adjust to changes or daily requirements, physical, mental, or emotional. This is conscious. For example, I'm going to lift up a heavy weight. I'm going to take a deep breath. I'm going to hold my breath and lift the weight because I'm adjusting the breath in order to what I want to accomplish. Same thing what happens the other way around. For example, this is a funny example, but it's a very telling example. I'm traveling and my bladder is full or my rectum is full. And I don't have any place to go. The bathroom is not quickly available. What do? I breathe shallow and I breathe, I adjust my breath so that there's no increased pressure in my belly. Otherwise, the whole problem will happen. So I can adjust. That's my conscious adjustment during day-to-day life. Allostasis, a couple of examples like that. There are many of them. particularly running around, and how you adjust your breath to that. You start panting, you start breathing more, all that stuff happens. That's the allostasis. So the new word is now hormesis. What is hormesis? Hormesis is a building of resilience, immunity, capacity, and overcoming any kind of challenges. And this is an area where nowadays we have many examples. For example, somebody is going to high altitudes. Their oxygen requirement is different. Oxygen tension at their high altitudes is less. They have to adjust, and they have to really build a capacity to be able to extract more oxygen. That's what building resilience means. The other resilience that we talk about, or immunity we talk about, has to do with, for another example, classic example, is that of giving shots for vaccine. Now, the vaccine is ordinarily harmful to us, but that body learns to develop immunity because challenge is there. Exercises, we go exercises, lifting weight. All this is all called hormesis. Hormesis is a very important way to build ourselves much more. Now, I want to journey through the airway and pulmonary anatomy and airway journey, because we learned anatomy, how the anatomy makes a difference. So the air enters through nose and mouth. There are two ways to breathe. Okay, nose is a small area here, nostril, but look at the capacity. Look at the area that you see size of the nasal cavity. And the oral cavity is a small one because the big tongue is there. The oral cavity is small. However, because there's a small entrance here, the resistance to the air coming in or going out is actually different. Is much more in the nose versus the mouth. Right now, if you just open your mouth and breathe slowly and feel what the resistance is, it's much easier. And you close your mouth and inhale through the nose, the resistance is much higher. Now, so why is nose breathing preferred? Because it has more time for it to moisturize inside here, filter, and also get something called nitric oxide is generated within the nasal sinuses. Besides, when the air goes inside the chest and you exhale, there's more time that it takes to come out, and there's more time for the oxygen exchange to occur at the lung level. So this is a mechanism which is normal that is created. If we do a mouth breathing, there are so many negatives that come up. Children develop tonsillitis and infection in the mouth, etc. But besides that, a lot of other things. So I just wanted to make sure that anatomically we recognize this part of it, and we'll practice some of the things as we go along further. So breathing through the nostril, breathing through the nose. There are many other disadvantages of that, and I'll come to that in the next few slides. This is I call that the most ignored muscle in the body, diaphragm. There's no exercise meant for diaphragm except the ones that we have talked more about. It's shaped like a parachute. It's really the huge muscle like that. And diaphragmatic breathing, therefore belly breathing, we talk about the diaphragm moves down. It's like a tent. And we'll describe that when we do the practice. But let's not forget that this is very crucial apparatus. Of course, the accessory apparatus with the chest and the neck is there. Let's go to the mouth breathing versus nose breathing. You can see that mouth breathing uses secondary muscles, and this is primarily diaphragm with nose breathing. The dilatation of blood vessels, and I'm just going to go this side because it's much easier to see the advantages. The nitric oxide is produced much more because of nasal breathing and sinuses, and that dilates the blood vessels, dilates the bronchi, bronchodilator, and also it is creates anti-bacterial and antiviral, believe it or not. It's for the COVID, it has become very useful to think about this. It improves sleep quality and all that we talked about, and filter. And important thing is it triggers the parasympathetic system, and this triggers the sympathetic system. So now let's go to the chemistry of it. The chemistry of breathing is very important. I'm going to go through medicine. Medicine is like a chemicals, right? When chemicals are produced in the body, they help. So there are three gases, the story of three gases. Oxygen, obviously, used by all the tissues in order to survive and run the metabolic functions and so on and so forth. And all the cells depend on this oxygen uptake. Lack of oxygen can produce a lot of issues. Carbon dioxide is an interesting thing. And what we noticed here, and all of us remember that as the carbon dioxide starts building up in the bloodstream, the pH of blood goes down a little bit. And when it goes down, become acidic, and the brain says that triggers the more response to say, hey, breathe. And that is a response created not by lack of oxygen, but slight increase in carbon dioxide. This is an important thing to consider. And that we call it in breath medicine, we call it as a chemosensitivity. And when we manage this part, this particular two gases, and start becoming tolerant to slightly increase carbon dioxide, slight increase in carbon dioxide. And how would you do that? There are many breath practices that we do that. Breath holding, kumbhak, for example. These are all examples of how you build yourself up. But this is dependent upon this chemosensitivity mechanism. Nitric oxide, we already talked about, and how we generate more. We'll go to that more. By the way, nitric oxide is generated maximum in the sinuses, more than even lungs. Then there are neurotransmitters. Adrenaline is sympathetic, acetylcholine is parasympathetic, serotonin and oxytocin. Interesting thing is when you inhale, the sympathetic system comes into picture. Your heart rate goes up, your respiratory rate goes down a little bit, and you get more cardiac output. When you exhale, as you see the graph coming down like that, you relax, and parasympathetic systems that comes into picture. Serotonin and oxytocin also increase when you switch the proper breathing techniques. Other chemicals are surfactant. Surfactant is like a soap film that is produced in the lung and lining and the alveoli. When they stretch, they produce this surfactant. And that is like reduces the surface tension of the surface of the lung area. And that keeps the lung elastic. Why is this important? Because COVID has shown the virus comes down to the lung and it actually attacks these cells that are causing surfactant. And the surfactant is less and the lungs become stiff, so on and so forth. Stiffness of lungs occur in many, many other areas. And so what breathing techniques? There are some breathing techniques that can help this. Other hormones, we're not going to go into details of this, pineal, melatonin for sleep, and pituitary, and all these things are all affected by the proper oxygenation. And immune system, lung endothelium, intestinal endothelium, and immunoglobulins. And many enzyme systems. All these things depend upon proper breathing. Breath is life. And how does it happen? Same thing with red cells. When the red cells are being oxygenated well, if you have breath holding done for only 30 seconds or so, the spleen contracts, and we see all the extra RBCs are put out. This is proven by CAT scan. Erythropoietin comes out also because of this reason, and then new cells can be generated. So breathing can handle all these things. Same thing, breathing can change WBC, it can affect on marrow and all the vital organs. Breath really works very well. Role of mechanical. Mechanical is very interesting. I show you a big diaphragm there. The diaphragm comes down, it pushes all the abdominal venous vein and to empty back into the heart. That's what is needed when you breathe in. The oxygen comes in, and when oxygen is important, the blood has to be oxygenated. The circulation and cardiac function is improved because the diaphragm went down. Same thing, lymphatic pump. This posture and lumbar spine stabilization by diaphragm is important. I'll show you a picture in a minute. Managing the accessory muscle is important, and I'll talk to you about that in the actual practice. And conscious breath control techniques, there are a few of them: volume control, inhalation, phase control, time control, cadence, how long you take, breath holding, and directing the breath to various organs. This is just for introduction. This is the diaphragm. Look at this. The diaphragmatic slips are attached all to the spine. So when you breathe in and hold your breath, it actually like a tent. If you have a tent, and tent is tied down by ropes, and the ropes tighten, and you can actually tighten the tent very well. So that is very good during walking, during marathon running, etc., etc. If you're not doing proper breathing techniques synchronized with the walking, you will have trouble with the spine. You will have trouble with the people with lumbar issues and all. Even people with lumbar issues, pain and everything, back pain, they have to learn how to breathe properly, and then they can also be helped. So this is a very important function that I did not know until Patrick McCowan pointed that out. It's funny because we're doctors, we should know all this, but we didn't. This is an interesting thing. When you are sitting up or standing, 2/3 of the blood is down here. So if you do diaphragmatic breathing properly, deep breathing they call it, properly, then it gets redistributed like this, and the air-blood exchange occur well. If you are doing only the thoracic breathing, you know what happens there. Blood is not there. So this is all a dead space. So you need to change the way we breathe properly so that proper oxygenation takes place. So what are the various applications? And I'm just going to quickly with the applications here. In sleep apnea produces snoring, and we see that mouth breathers are most important here. And we even advocate taping the mouth and etc. There's few techniques that we use for sleep apnea people. Asthma, bronchospasms, anxiety, all of these are applications how we can apply our breathing techniques for that breath medicine. Panic attacks, weight management, a very interesting part. Proper oxygenation leads to easier satiety and all that. We can talk more about it. Same thing with physical injury, fatigue. How can you recover from that? Heart circulation we talked about, and the brain function, concentration, and how to create active productivity. This particular part I use a lot more in society. For example, working class. Okay, people who are in major industries or going to work, they have to have proper concentration, and you can get that from proper breathing techniques. Children, very important to learn from the very beginning proper breathing methods so that they do not develop situations like, for example, growth of the facial bones, and also dentition, how the dental lines up. All this is affected by improper breathing and mouth breathing. Chronic fatigue syndrome, athletics. I'm going to go to this area because athletic performance is very crucial, how to adjust the breath. People who go, as I said, climbing mountains, and second is going down into the ocean, for example, deep divers, they have to be able to properly breathe. The swimmers, for example, they have to also use that. Now, these are the various things, mechanism, oxygen sensing, physiological. We have covered most of them, except I'm going to say embryonic development. Mothers and in OB area, we have to recognize how the mother should breathe. Immune, altitude adaptation, respiration we talked about. And we also have all these other points that are important: stroke, infection, wound healing, myocardial infarction, and all that, so on and so forth. So these are the various applications. What is the future? Future is light breathing is right breathing. We're going to deal with this as we practice this, and I'm going to show that during practices. Cadence is 5 to 6 breaths per minute. Normally we breathe about 12 times, but I can show you how we can get to that. Biochemical, biomechanical adjustments that we talked about, where less but efficient oxygenation adjustment. You have to have efficiency. Sleep problems, snoring, we're repeating some of these things: asthma, chronic illnesses, cancer, very important cancer. Why is it? I'll show that in the last slide. Viral infection, COVID, athletics, performance we talked about. This is the hypoxia. This is the award-winning, hypoxia-inducible factor. These are the transcription factors, genetic, that respond to decrease in available oxygen. And the HIF comes out from, this is complex, but HIF comes out from the hepatic circulation, and genetic expression happens. The important thing is when the tumor cells exist in low oxygen tension. As you know, tumor has less vascularity in the center. And so there's less amount of oxygen there. And tumor is happy with that, actually. That's what happens. And so if you allow a lot of breathing, a lot of oxygenation to the tumor, the tumor can grow. So these people have worked on inhibiting this factor, inhibit the HIF by some medications to help cancer. So this is still in research. And how do you live longer? This is an interesting area. Breathe less, breathe slow, breathe deep, more whole breaths, nasal breathing. And this guy is breathing only 2 to 3 minutes and lives about 150 years. Can we do longevity? Is longevity. And I just want to end with saying that Optimize Your Breath is the program that I came up with, OIB, that combines everything, yoga technique and oxygen advantage, as well as Tai Chi, Qigong, Zen techniques, and all the medical science background. And who has to optimize? Anyone, any age, anyone who breathes needs to optimize. Optimize means what? Optimize means sufficient and efficiency in all situations. Very important, all situations. When do you breathe and when do you optimize? Anytime when awake, even the busiest lifestyle, you need to follow. What are the situations and requirements? Any situation, no special requirements for learning the breath techniques and using it. In bed, sitting, standing, walking, exercising, day-to-day activities, sickness, hospitalized, nursing homes, athletes, higher performance, body, mind, energy needs. In fact, believe it or not, I'll give you one interesting example. People on ventilators. Guess what? Ventilators use something called a sigh mechanism. They introduce a sigh. In our body and our brain, we have a sigh center. Normal sigh is important. Why is that important? So this is a very fantastic aspect that it is something for anybody and everybody. And I have some programs of certification. I call that OIB practitioner, leader, and trainer. We have ongoing breath clinic, on Zoom and everything. And so, people can follow me and learn and practice with me. So on that, what I would like to do for remaining few minutes is I'd like to practice with you some of the techniques that I'm mentioning and why I already mentioned, why it's important. So I'm going to start with the entry point. I call this a breath laboratory. We are the lab directors in our own body. And it starts with the nose, okay? 2 entry points. And we breathe through the 2 nostrils. So let's do this. Let's inhale and exhale through nostril block 1 and inhale and check how much air is getting there through the 1 nostril. Inhale and exhale. Now close this nostril and inhale and exhale. Are they equal?
No.
Not really. There is unequal. Now, if you have 2 unequal gates, amount of air getting in through the gate is not equal, correct? And so is it important if you had both of them open? Yes. Now, interesting part about this is that this is called nasal cycle. This is designed by nature. This is true for everybody. 2.5-hour cycle, there's a rhinencephalon right here that controls this cycle. And why is that cycle necessary? Well, otherwise it will dry out, the 2 nostrils will dry out. If air kept on going, it's like big fan, So we have to have alternate nostril breathing, which happens normally. Now, how do you open it? Before you practice anything, before you do the breath practice, pranayama, whatever you want to do, you have to be able to open it. So let me show you how to open it. So inhale, exhale, inhale one more time, exhale, and then pinch your nose, hold your breath at this time. Keep holding, move your neck sideways, move it around, keep holding the breath till you have to breathe. You will reach a point when you say, gee, I have got to breathe. Holding. And then let go. Feel the amount of air coming in now.
Yes.
Much different, isn't it? Check it. A lot of difference. So check it again. Whatever nostril was coming in? Is it improved any?
Improved little bit.
Little bit. So now you can repeat this process till you open all of them up. This works by creating more nitric oxide. As you trap the air inside the sinuses, it opens up. So now I will tell you one more. So that's one thing. Before any breathing techniques, before any breath work, if you don't do this, you are not getting the benefit that you want. I'm going to say I learned this a hard way, but I learned it from Patrick. Patrick did not do the yogic part, but I do recognize the importance of this. So open up the nostrils as the first step in the morning. Do it or anytime you need to do. How long will it stay equal and open? 2.5 hours. Nature will take over. The brain will take over. And it's not going to be open all the time. But while you are practicing, you can get the most benefit by getting proper air. So that's number one. The second point I want to do is interesting. Just frown a little bit. Just frown on your face a little bit and inhale. And exhale. Notice the amount of air coming in. Now smile. Smile and inhale. Is there a difference? More air coming in when you're smiling? Yes?
Yes.
Yes, more air. So smile. Smiling introduces more air. I even advise people to say, learn smiling in front of a mirror, Why did that happen? Because of two muscles here. There's one muscle here. It's the longest name in the anatomy. The doctors are here, so I'm going to tell you. Levator labia superioris eloquenasi. Levator labia superioris eloquenasi. Nasal folds. Now, if you do this, for example, just put the fingers here and open them up. Now inhale. Lot of air, isn't it?
Yes, it's easy to inhale them.
It's much easier to inhale. Now we're not, the soft part of the nostril opens up. And this muscle is also called Elvis Presley muscle. Why did they name it Elvis Presley? Elvis Presley smile is like this. If you look at his picture, it smiles like that. They call it Elvis Presley muscle because the muscle opens up it's a little crooked smile, but opens up the nostril. So I make a fun of that, saying that if you look at his Elvis Presley, his left nostril is much open because his right brain is functioning, much more functioning well. So I make a fun of this thing and say, okay, but the important thing is smile. And now you frown. Make a real frown. And inhale and exhale. The amount of air and the resistance is a lot more. You got it? And inhale and exhale. See, all of a sudden, when you frown, you're not getting enough oxygen. Your brain is going to suffer. Every organ in your body is going to suffer. So if you smile, every system in the body will like it. They say, we love it. Whatever you're doing, we love it. So that's what it is. So this is allostasis, you see, how you adjust yourself for it. Okay. Now what we're going to do is something that I enjoy. Let's massage the sinuses. Now massage, this is massaging the sinus. And tap it. This tapping and massaging increases nitric oxide. It mobilizes secretions and everything. So now, one nostril is closed. Bend your head toward down that way, that side. And then tap on the other side. Tap on the area, tap on the top, and inhale and exhale. Deep inhalation, exhalation. Feel the air going into the sinuses. Beautiful, isn't it? It fills up so beautifully. And then I also advise something else. Start humming. Inhale and exhale. Inhale and hum as you exhale. What is humming to do? Humming produces 20 times more nitric oxide. Measurement. Yes. So humming and om chanting, we'll do a couple of that right now. chanting and humming. Humming is extremely important. We already have the breath. The what do you call that? The pranayam they do, the Brahmari pranayam. We already talk about Brahmari pranayam. What's the importance of that? That increases the whole aeration. It's a sound vibration plus nitric oxide. So this tapping. Now go on tapping the ethmoid sinuses here, just next to the nose here, then go up into the frontal sinus. I have done this tapping, and people have actually sinusitis and all that have disappeared. Humming, breathing techniques. This side I do temple because the sphenoid is located in the center, sphenoid sinus. Okay, you can't reach the sphenoid center, but when you tap both sides like this, the vibrations go into the sphenoid area. It is helpful. So tap, and then tap the face here. Again, now tap the underneath the nose, and then massage the gums. Massaging the gums is very helpful because it increases the blood flow to the sinuses, and it's very helpful from that region. I'm not going to go into other reasons here because there are Tai Chi and all the nerve endings are right here. Massaging the gum. So now inhale and exhale. Raise your hand up and exhale. This allows us to exactly regulate the amount or the timing of the inhalation and exhalation. The hand movements helps us. Okay, so taking care of this area. I won't go into too many details. I'm going to go. Another technique that I'm going to use is deep breathing versus full breathing. So I'm going to stand up and show you. You may sit down, you may stand up if you want to, that's up to you. But I'm going to stand up and show you. Now, diaphragmatic breathing is when diaphragm is like a dome like this. See, when I inhale, diaphragm goes down. When I exhale and the belly comes out. When I exhale, this is what happens. It's exactly the diaphragm. I showed you the dome, like a tent. So when I do this, inhale, exhale. How do I know this? I can put my hand on the belly, one on the chest, and inhale. Belly comes out, exhale. That's one way to do it. The other way to do it is I put my hand, this is the hand, I put it in the lower rib cage like this. And now if you see me inhale, my head is not seen, but you're going to see the hands. Now if I inhale, my fingers are separating. The lower rib cage is expanding. This is the conclusion that I'm doing diaphragmatic breathing. A couple of ways to check that, and we have many other ways to check this, but converting into diaphragmatic breathing is an effective way of doing it. So now, if you're breathing the lower two-thirds of the lungs, as I said, what about the upper two-thirds? It's not necessary to aerate those areas. Of course it is. It's like a spare tire. If you had a spare tire in the car, if you didn't check the air in the spare tire, when you really need it, it will be gone. It won't be useful. So this is also to be exercised. Now, how do you do that? Well, so I will show you. The way I recommend to do is inhale first. Inhale, like I keep my hands here, so I know I'm inhaling. Inhale, the lower chest, upper chest. Start looking up, continue inhalation. Look up, throw your arms out, and smile. And then you exhale, come down slowly. Exhale, exhale, exhale. Now, why does this work full? When you get your arms out, the scapula moves out, the clavicle goes up so that the rib spaces expand. When I do this, people intubate, why intubation you do this? But it reduces the dead space. So you do this, look up, and then smile. Smiling also improve the air. So everything to get full advantage of the inhalation. So the technique for doing this is this. If you just sit there and do it, yeah, you can do it, but the chest has a lot of resistance. So this is the way we talked about deep breathing, etc. And the last thing I'm going to do today, there's something called, we do breath symphony. I'm not going to do breath symphony today. When we do the actual practices, we incorporate that. But I'm going to do Om chanting. And so let's do the Om chanting, and you will chant with me. And the way we will do it is, you inhale, and then Om, like that. Okay? Or I would do the other way around. Let me do the Om chanting the other way around. This is the easy area. Inhale first, and as you, A, U, and M, three letters come. So let me show you, demonstrate that. Inhale, and 25%, 50%. Is 50%. So. And goes down again. Inhale. Inhale again. And the last time. Silent for about a few seconds. If you notice, I was timing it with my center second watch. We did 4 ohms in 1 minute. And if you did not feel short of breath, your breath rate was 4 per minute. How do you like that? Okay. So Om chanting will reduce your breath rate very beautifully if you do, that segmental in the practice. And by the way, you're yawning and you're swallowing. That is parasympathetic. You're switching to your vagus system. That's what's happening. And that's what expected to happen with proper breathing technique. So it's interesting that you did that. And we do that in our breath clinic. It happens all the time. So, as I said, there are so many techniques and so many, but recognition of why we do that and how it affects our body, mind, and spirit. This is spiritual. I have not done anything about the spirit part yet, but all the chakras and how it affects various systems that we have, energy systems and conducting message system through chakra, nadis, and in meridians is what we call in Chinese philosophy. They are very similar. 76,000 nadis, 76 meridians. Where did they get this number? They both got the same numbers. So on that note, I really appreciate you being with me. And I truly believe that proper breathing can address all the body situations, any body situations, mind situations, and spiritual aspects as well. So it's one of the most important discoveries that I had in my last 5 years. And I'm really enjoying the fact that you invited me to share this breath medicine with you. Thank you.
Interesting, Dr. Kalind, that breath is so useful in managing so many health parameter and health conditions. And I, at Spiritual Doctors, we sincerely hope that breath as a medicine, breath medicine department should come up at different medical institutions. Until the time medical fraternity awake for the healing effect of breath, our friends can join Breath Clinical Lab of Dr. Kalind Bakshi on Tuesday and Thursday, 7 p.m. in Indian Standard Time. And soon we will invite him for lots more of practical sessions. He is more fond of doing the practical. And we will learn more about breath medicine in our future session. Thank you, Dr. Kalind, for joining us. Spiritual Doctors for Holistic Health पर आने के लिए आपका बहुत बहुत धन्यवाद.
Welcome, Dr. Ranjan. Thank you very much for giving me this opportunity. Thank you.